Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So we presently have 613 cases. That's up 4 cases from Friday, or up 7 cases from July the 7th, when I last reported last Tuesday. If we look at those cases, the 4 cases, they're all males, ranging from 40s to 60s, 3 living in Simcoe County, 1 living in the District of Muskoka, 3 are community acquired, and 1 acquired in the workplace. All are in self-isolation. 1 of them is asymptomatic. So that means that in the last week we had a total of 7 cases, and that's actually the smallest number of cases we've had since near the beginning of when we commenced with having cases at all, with the beginning of the pandemic. Last week we had 10 cases, which had been the lowest number that we'd had. And then before that, we had 2 weeks back to back that had 40 cases. So we've most definitely come down quite dramatically. Also, we have no outbreaks at this time. So we had 1 workplace outbreak in a food processing plant in Simcoe County, and that came to an end on July the 10th. There were a total of 7 cases, 2 residing in Simcoe, Muskoka, and 7 residing out of our district in other health units. With those 5, 2 residing in Simcoe, Muskoka, 5 out of district, those 5 being captured in the numbers of those other health units. So right now we have 556 who've recovered. That's 91% of the total. We have 4 individuals hospitalized. That's actually up from 3 from last week. None in the intensive care unit. Currently, we've got 14 individuals in self-isolation recovering at home. We've had no additional deaths, so that's 36 deaths. Our last death was on May the 16th. So this is an excellent trajectory at this time. Definitely we have a reproductive number that is below 1. And as I said before, that's a measurement of the growth of the pandemic locally, and if it's below 1, that means it's shrinking in size. So there are a couple of things that I would say are happening right now of note. One is that today is the day in which my instruction to our businesses and organizations takes effect, requiring that they have in place a policy that would require that all individuals who are in the public locations of those facilities wear a face covering or a mask. And by this I mean, generally speaking, a cloth mask for the purpose of preventing transmission to other people. Other than the wearer. The person who's wearing the mask doesn't actually receive much protection from a cloth mask, but those around them receive protection. And so if we can have a very high percentage of people who are wearing masks in those environments, that reduces transmission and helps us keep under control the pandemic. Indeed, this has led to a lot of calls that we've received. So last week, up until Saturday inclusive, we had a total of 1,069 calls, and the great majority of those were related to mandatory mask use. And this morning we had an additional 43 calls, the majority of those related to mask use. So if you look at the topics that are raised, a lot of them were businesses or organizations seeking clarification about whether or not this direction applied to them. And if so, in what way, in what environments within their organization or their agency or their business would it apply? We certainly had people who were very upset about it and were debating with us whether or not this should be done. And in those instances, my staff, took that information and provided basic information about the policy and indicated that that information would be brought to my attention. We received emails as well with the same range of questions and comments, those for it and those against it. Some of the questions were related to evidence supporting the approach, why or why now, and some questions about multi-unit buildings, multi-unit dwellings, or multi-unit housing, and clarifications about whether or not it applied in those settings. We also received some questions about face shields and whether or not face shields could be used as an alternative. We received questions about plexiglass and what would be considered to be sufficient protection from plexiglass, and also about exemptions, who's in and who's out with this requirement. So if I go over some of the topics, I would say the question of who's in and who's out is within the letter and within our communications. We have a lot of information up on our website, Q&As, a model policy for these facilities to use in that my letter of instruction indicates they need a policy, so they have a model policy for them to use. But if you look at that information, I would say with regards to the plexiglass question, we want it to be sufficiently protective, and by this we simply said that it needed to provide a complete barrier, and that an example of something that wouldn't be sufficient protection is a plexiglass barrier in which one could walk to the end of it and be within reach of the employee when you're at the end of the plexiglass. So many retail arrangements are going to fall into this category, and so in those situations the staff are going to be required to wear a face covering to provide that kind of protection for their clients, for their staff, for their customers. Face shields. So there have been instances where people would prefer to wear a face shield, a clear plastic face shield, instead of a mask because of comfort, or because that way their face could be seen, or ease of communication. But the evidence about the protectiveness provided, the protection provided by face shields, is weaker than it is for masks. And so we are indicating that a face shield is not a substitute for a mask, according to my letter of instruction. Certainly, if there are individuals who are exempt from my letter of instruction, if they have a medical reason for not wearing a mask, or a young child, then they certainly, if they wish, could use a face shield instead, and certainly somebody wearing a mask could use a face shield as added protection of the eyes. But generally speaking, face shields are not to be viewed as a substitute or an alternative to the mask. If we look at some of the other matters that were raised, at this point in time, we're indicating that multi-unit dwellings, according to our Q&A, are considered to be private locations. Certainly, they can choose to have their own policies about requiring masks in those locations, but at this time, what we have on our website is that they're considered private and not considered part of my letter of instruction. We had a lot of questions about evidence, so there's on our website links to evidence and reviews from the scientific literature about this kind of requirement for face coverings. But the real bottom line is that the strongest evidence is ecological in nature. It compares countries, those countries that have done well and those countries that have not, to look at the timing of the application of a requirement to use face masks or face coverings, and showed a correlation that a substantial amount of transmission can be prevented if you have a high degree of usage, 80% or more, for face masks or face coverings. And also that mathematical modeling supports that as well. Our strongest argument, I would say, is that we're opening up the economy now. We're going to be hearing from the Premier momentarily about Stage 3 and what regions of the province are included in Stage 3. and what venues or public spaces can be opened, and whether there are other restrictions that are lifted. So as I'd indicated, as we reduce restrictions, we increase the chances of transmission. And so although we have a very low number at this time, it's very good to have this kind of protection in place as we open things up further. And also because the research, the mathematical modeling shows that this kind of intervention, having a high degree of mask use, works best early on when you have a low degree of transmission rather than late when you have a lot of transmission happening. Certainly if people have questions about what's included and what is not, generally speaking, we're talking about the public locations within businesses and organizations, so not the back office, away from the public. And also at this time we are exempting schools and childcare and summer camps. And the reason for that is because there are provincial direction guidelines in place for the management of those venues. And we would also say with regards to schools that we expect more in the way of provincial direction from the province as they open up in the fall as to how they are to be operated. Certainly it is entirely appropriate or possible for me to reissue a letter of instruction or a letter of direction to agencies, to businesses, to organizations, to transit providers, and that this is, my letter includes transit, public transit as well, so I can reissue that when needed. If there are new things that come up, new issues that come up, I can change what's actually needed in order to respond. So certainly we've had questions about schools and why are schools excluded, and as I'd indicated, we expect more specific direction from the province about exactly how they're going to be running schools from the Ministry of Education. I'd like to, at this point, reiterate just how important all of our work together has been in flattening the curve and bringing the pandemic to a very low point here in Simcoe, Muskoka. That's the work of us all, and it's certainly the work of businesses as well, those that have had restrictions placed on themselves, and abiding by those restrictions, and putting in place changes so that people can physically distance, and people can hand sanitize, and maintain the numbers low enough in those premises that people aren't compromised on those things. And some of the businesses have gone ahead of my own direction and put in place a requirement for mask use to protect their employees and to protect their customers. All of that has helped to achieve the success that we've achieved. Certainly the work we've done in public health as well with case and contact management and calling up and following up all the positive test results to have people self-isolate has been essential. People going forward to get tested and to put themselves into self-isolation when they have symptoms has been an essential contribution. So we've all contributed to this success. I want to take a moment to commend everybody for this success and to point out that we need to continue this. That we've seen in the United States, southern United States, for example, a loss of the control that they had achieved by letting things go without sufficient restriction. And I think that needs to be a warning to us that we need to maintain care and control and caution and keep in place the physical distancing, now the mask use in indoor public places and workplaces that are accessible to the public, I should say. That people need to do hand sanitization and self-identification if you have symptoms, isolation and seeking testing. All of that needs to continue, or the numbers will come back up again as they have in the United States and certain other places of the world. So internationally, we're challenged. The numbers grow ever greater as we close in on 13 million cases in the world, and an ever larger number of cases day by day. So in the past 24 hours, there were over 230,000 new cases in the world. In Florida, there were 15,000 cases, and Florida is not much larger in population than Ontario, by way of comparison. And this speaks to the fact that internationally we are very far from controlling this pandemic. So while we've done a good job here in Canada and in Ontario, we need to be mindful that it's still happening in a very big way around the world. So today the Premier will make some announcements about Stage 3 reopening. I look forward to hearing his announcement, and we as a health unit will respond accordingly to do all that we can to transition into a safe Stage 3. And of course, we're going to continue with our surveillance and continue with our reporting, continue with case and contact management, and continue with direction and advice and support to businesses and other public venues and other public organizations with regards to the safer management of those public spaces. So at this point, I would be happy to take questions or comments.
Okay, thank you, Dr. Gardner. James Bowler from Coachco, do you have a question for Dr. Gardner?
Yep, hi there, thank you. Dr. Gardner, just wanted to ask you about the direction that you had previously given regarding the COVID-19, the mask situation in businesses. Initially, it said it was an education purpose only, but a letter to the businesses stated that there was a fine possible. Can you just provide some clarification on that?
So we provided that because it's disclosure of what is possible. That is the levels of fines that exist within the Emergency Management and Civil Protection Act, which is the basis enabling me to issue that order of direction to our businesses. But we actually have very limited resources to enforce. We would, in theory, be able to use our public health inspectors to enforce. We could use, or municipalities could use their bylaw officers. Police could enforce, but we've been informed by police, by municipalities, that they are very limited in their resources to be able to put to this, and we certainly are limited in our resources. So we are taking an education approach, a follow-up approach, I guess, when we get complaints for educational purposes to these venues. I've heard from colleagues who've gone before me, done this before me, in particular in Wellington, Dufferin, and Guelph, that approach actually has been effective rather than requiring the issuing of fines.
And just to follow up, we had some communication regarding issues with receiving test results in Muskoka. I'm not going to name names or anything because obviously privacy concerns, but I just wanted to see if there was some issue with test results coming back, because the gentleman I spoke to said he had 3 tests done and all 3 had not come back to him. Was there an issue? Has that been resolved? Can you just give me some info on that?
So while we have been getting most of our results back within 48 hours, there have been instances where we've had actually quite long delays. The system that has evolved with laboratory testing is complex. There are many labs that have come online, private and hospital, well beyond the original Public Health Ontario laboratory system, and in order to handle the volume of testing, and that has led in some instances to testing results having gone to a nearby health unit first before being forwarded to the health unit in which the individual resides. So there have been instances where there have been fairly long delays.
All right, thank you.
You're welcome.
Thank you, James. Erica Engel from Barrie Today, you have a question?
Hi, yes. So Premier Ford just announced Phase 3 on Friday will include gathering of 50 people indoors, 100 people outdoors, restaurants serving indoors with physical distancing, and playgrounds and gyms to open as well. And then I think pretty much every other business can open now. Just wondered if you had any thoughts on that.
Yeah, thank you very much for that. So I'm certainly going to have a close look at exactly the wording on that to give a precise response. But that is the kind of thing that I was anticipating. And it does speak to the importance of and the potential challenge of maintaining the physical distancing and all of that. And the importance now of using face coverings as well as an additional measure of control, additional source of protection for people. So certainly as a health unit, we will need to look very closely at the details and identify what education we need to be doing to those premises. I'll have to look at the question of the gatherings, to know whether or not that's in general or if that is an identified event or venue, because there would be a difference between people being allowed to just spontaneously gather that size of the group as opposed to it's limited to a particular venue or particular event. But regardless, physical distancing will be needed in those instances where people are gathering together. And the masking indoors is certainly going to help in those instances as well.
And what about specifically playgrounds and kids playing on playgrounds? Do you have any advice for that?
Well, I am happy about that because this has always been a trade-off. These control measures have always had a cost. And one area of impact has been on children and child well-being. We become concerned about, for example, the loss of access to school as important to mental health and well-being for children. Certainly being able to get out and be physically active is important, and playgrounds have always been a great venue for that, for children to come together and socialize and have fun together and be physically active. So in that regard, it's a very good thing that we've got to the point where we can do this, where we feel we can do this. We also have had ever increasing research on children, and we now believe that they are less susceptible to transmission and to transmitting to others and to complications compared with adults. They can still get a inflammatory disease related to COVID-19, but on the whole, they're less vulnerable. And we now know that outdoor environments are safer as well. Both the fresh air circulation reduces risk, and UV light, sunlight, also is virucidal, kills this virus. So outdoor playgrounds would be made safer because of those factors, because of the exposure to sunlight, because of the fresh air. I think, it's still important that we're advising children to physically distance. I know that's really hard for them to do. And in my life, when I've been out and about doing my own physical distancing from other people, I certainly see evidence of children not doing that. So it's hard to get children to physically distance, but I would still be encouraging them to do so even when they're on a playground like that.
Okay, thank you, Erica.
Sorry, can I just clarify the Innisfil case is workplace related? Is that the food processing crane? Is that a workplace outbreak or?
So we don't give that degree of specificity of information to avoid individuals being identified.
Okay, thank you.
Okay, Nathan Schubert from the Moose. Do you have a question for Dr. Gardner?
Yes, I do. Good afternoon.
Good afternoon.
Dr. Gardner, after last week's announcement of the mandatory masks, we've been seeing a lot of online commentary of people promoting kind of false scientific facts, claiming that masks could actually worsen conditions or eventually kill, or people saying, my body, my choice, all those kinds of messages. What do you have to say to those people?
Well, certainly this is new. This is a change, and probably feels very abrupt to people. I have been advising for 3 months that people use masks in indoor public places where they cannot physically distance from others. But to require it is going to feel very abrupt to people. I would acknowledge that. And it is a change as well, which is hard, particularly if it's imposed on people. The purpose is to avoid transmission, keep our rates low, and avoid, as we open up things in stage 3, a deterioration and a regression and the need to reimpose a lot of the restrictions that are now starting to be reimposed in the United States. I'm well aware that when you make a change like this, there are going to be people who will be opposed to it. We do have good quality scientific evidence linked on our website that I would invite people to have a look at. I have had some email communication from some providing me with concerns about masks in general. The evidence that I've seen has been related to medical masks, and in particular N95 masks that are very non-porous, very sealing, that can be impose some degree of difficulty breathing, and can, if worn for a very long time, cause an increase of carbon dioxide in the body. But that's a particular type of medical mask, not a cloth mask, which is much looser, much easier to breathe through. If people want to have a look at the potential downsides of mask wearing, there's a good review on our website, linked from our website, that is provided by Public Health Ontario, that cites that it can cause irritation of the skin or worsening of skin conditions if worn for a prolonged period of time, that if people aren't careful about how they put them on and take them off, they can, in fact, contaminate their hands from the handling of a mask, and they could potentially then touch their eyes or their mouth and cause infection, or touch a surface and contaminate it and potentially spread infection. So people do need to be careful with face coverings and how they put them on, how they take them off, and that they use hand sanitizer when they do so, and that they wash them as well. So there's certainly things that people need to be cautious about with masks, and I think it's important for everybody to become more educated about all of that.
My other question was, in last week's announcement, you note how there is some individuals who have exemption to the mandatory mask announcements, like young children, people of certain religion, and those who have certain medical conditions. Do certain people within these exemptions need to provide proof? And if not, why not?
So we are indicating that they do not need to provide proof to the premises, the businesses, the organizations, the public transit. We're considering this to be enforcement in good faith with best effort, and don't want it to be excessively confrontational or onerous to everybody involved. And so for that reason, we're indicating that that kind of proof is not necessary, that people should, the operators should, by our instruction, take at face value when individuals indicate that they meet those criteria.
But this could let people claim to be part of this group of exemption without actually being part of it, right?
It's possible. It's also possible that people simply refuse, and with our instruction, it's not necessary that a business refuse them entry to still be in compliant with what we're directing. We are looking for a high degree of compliance, but we know from the research, to achieve what we wish to achieve, we don't need perfect compliance. We're looking for 80% or more compliance to be effective in flattening the curve.
Okay, thank you.
You're welcome.
Thank you, Nathan. Elizabeth Smith from Rogers, do you have a question for Dr. Gardner?
Yes, I do. Hi, Dr. Gardner.
Hello?
I'm just wondering, it's already been addressed a little, but I am just wondering if there is a specific type of face covering that is best, in your opinion, or is it just the term face covering that you're suggesting people adhere to?
So we're looking for a face covering of some kind that covers the nose, mouth, and chin. And other than that, it can be a wide range of things: a bandana, a hijab, a niqab, a buff or a homemade or commercially produced cloth face covering, or for that matter, it can be a medical mask of some kind, particularly for people who may need it, people who have medical reasons for wearing a medical mask. The medical mask has the advantage of being protective for the wearer. So if you have an individual who's immunosuppressed, has a weakened immune system for some medical reason, then that could be a reason for wearing a medical mask. So that too would certainly be allowed according to my direction. There is a link on our website to how to make a mask, and in that I think you'll get a pretty good idea of what would be ideal. The ideal mask would be form-fitting to the face, would probably be triple layered and fairly tightly woven material. Some research suggests that polyester has a greater degree of filtration rather than cotton, though I'm sure it's not as comfortable. So if you're looking for more of the ideal, there is some information about how to make the ideal mask on our website.
Okay, thank you so much.
You're welcome.
Thank you, Elizabeth. Chris Simon from Very Advanced, you have a question for Dr. Gardner?
Yes, thank you very much. Dr. Gardner, going back to an earlier question that was asked, do you have a line, I guess, that you would look to be crossed before the health unit would contemplate instituting fines for non-compliance with mask wearing?
We will take a progressive approach. So if we're getting complaints within our limited resources, we will communicate back to a premise to work through the issues with them, in particular if there are multiple complaints. So I think we need to take it one step at a time. At this point, I wouldn't be committing to a particular endpoint of issuing a fine.
And then my other question is just about cases with severe complications. It seems like, it's been a couple of months, knock on wood, since anybody has died due to COVID, and it seems like, relatively speaking, the number of hospitalizations is down over the last little while. Do you have any suspicion as to why that's the case? Is it strictly a matter of keeping COVID-19 out of long-term care homes, or is there another reason why we just haven't seen as many severe cases as what we were early on?
Very good question. Certainly overall we've had fewer cases to begin with, but we've also seen a shift to younger cases. So there's been quite a substantial jump in the proportion of cases that are children or young adults. And we know that severity of disease is correlated with age as well as pre-existing medical condition. And that too is correlated with age. So we've shifted demographically from something that was affecting a very large number of seniors, particularly in senior homes and long-term care facilities, retirement homes, and is now affecting work environments and people in the community, community-acquired cases. And we've also seen more of the cases being due to screening of asymptomatic individuals, people who've sought testing without symptoms for a variety of reasons, including a necessity in order to visit people in long-term care facilities. And so by their nature, they're mild cases if they actually have no symptoms at all. So I think it's I guess a couple of things. We've managed to flatten the curve, get the numbers way down. What's remained is some cases occurring in the work environment as we open those work environments up. They tend to be younger people, and there's a certain number of cases that are just from the community, but they've tended to be younger people socializing, and we've had people who didn't have symptoms that were positive because of screening. It's shifted demographically.
Thank you.
You're welcome.
Okay, thank you. Is there anyone on the line that we may have missed?
Hi, it's Doug Ross.
Oh, hi, Doug. Go ahead.
any follow-up on the housing testing for resort workers?
Oh, thank you for that question. I did follow up with my staff, and on the basis of what you had observed, we proceeded with sending letters to those premises, similar to what we'd sent to the farms about conditions that needed to be improved or maintained to reduce risk.
Okay, terrific. And so will there be physical visits after that? Or?
No, I'm afraid we just don't have the resources. We're still tied up with everything else that's happening. But they have received our direction.
All right, terrific. Thanks for your help.
And thank you.
Okay, thank you, Doug. Is there anyone else we may have missed?
Mike from CTV Barry.
Oh, okay, Mike, go ahead.
Dr. Gardner.
Hello.
I was out today. This is going to be the report tonight. I'd say about 99.5% compliance wherever I've gone today. What would you say is the time frame here where folks are saying, how long are we going to do this thing?
I think given the arguments that we've raised for this is probably going to remain in place until we get herd immunity with vaccination and an end to the pandemic.
That could be 6 to 9 months of on and off masks.
It could be a year to a year and a half or more.
Do you think we're going to get fatigue? Do you think we're going to get complacency? Folks saying, you know what, enough of this. I can't do this anymore.
It's certainly possible that happens, right? With preventive intervention, it's hard to keep it up. And that will be one of our challenges. How do we keep attention on the issue, keep people motivated?
With regard to testing, what can we say about rates of testing right now across the Muskoka in the past week or two?
They're ever increasing over time. If you have a look at our website, we've got, sorry, my thing's just shut down, and I'm afraid I'll have to open up my computer again. But if you go to our website, you'll find under the health stats page a section called pandemic trajectory. Actually, COVID testing. Yep. Okay. If you go to our website, you go to that particular section. There's a graph that shows Simcoe testing, Muskoka testing in Ontario, how they all correlate. They are expressed in terms of tests per 10,000 population. And according to that graph, it looks like they peaked out at the end of June and have dropped slightly since that over the following 2 weeks. So it's come down a bit over the last 2 weeks, with Muskoka being at 80 tests per 10,000 and Simcoe being at 100 tests per 10,000, and Ontario looking to be about 115 tests per 10,000 population.
When about 3 months ago it was about 80, 100, and 120. So what did we reach there when we said it was tripled toward the middle of June when they removed the limitations for asymptomatic? Have we seen a 30% drop, 40% drop? What would you say there?
Middle of June? Because it looks like it's late June, actually I've got a specific date on this. It peaked, it appears, the week of June 22nd. So if you go to middle June, that's the week before. So the value there for Simcoe County was 110.8 per 10,000 the week of the 15th of June. And now the week of July the 6th, it's 97.8 per 10,000 population. So that, that's, I don't know, a 10% drop, I guess, something like that.
You're pleased with these testing rates and the results we're getting back?
Oh, they are high, And what's really critical to me is that people with symptoms have access to testing with a good turnaround time and a good follow-up on our part so that they be assisted to get into isolation, and we can do the same with their contacts. And in that regard, I'm quite pleased.
Thank you.
You're welcome.
Okay, thank you. Is there anyone else we may have missed who's on the call? All right. I think with that, we are finished for today. Thank you very much for joining us, everyone.
Thank you. Goodbye, everybody.